Hey everyone, in this video we are going to explore some ethnic and cultural considerations that might affect you in your nursing care.
Welcome to CASRN, where I teach you about all things nursing.
In this video we are going to briefly go over Hispanic and Latino considerations, Native American, Asian, Black or African American, and Amish considerations. My quick disclaimer is that I am not a part of all of these ethnic groups. I've done my best to research health-related material. This is also generalized information and will not be correct for every individual. So if you have something to add about your own culture, please comment below and we would all love to hear it and learn together. Just because someone does something differently does not mean that it's done wrong. So there's often more than one way to skin a cat, as I like to say, and a lot of different cultures have differing approaches to healthcare. So be considerate of those things and work with your patients to help them live their best lives possible. All right, first off, I want to cover language barriers. So you are required by law to provide interpretive services for your patients. And inside all of this, people will often fake understanding. When I was learning another language, I was living in Chile in Latin America, and people would talk to me and it got to the point where you just felt so stupid. You felt dumb, you felt like you should understand what's going on, and you feel like all the intelligence you've gained up until this point in your life means nothing. And then people would laugh or joke, and it was really hard to not take it personally. So in order to avoid those hurtful experiences, I would often act like I knew what was going on, when in reality I often did not. So if I would have had to have gone to a hospital situation and needed some very important education and information regarding my health, I would have probably resorted to this faking of understanding. So when we go to teaching and we're educating people about what they need to do when they go home, use the teach back method. This is telling your patient, I want to make sure that I explained myself well. Will you please repeat back to me or tell me what you understood from what I told you? And then this encourages them to understand and helps to clarify any misinterpretations that may have taken place. So language barriers are going to be huge in a lot of different areas. Please make sure to do your best to overcome those by being patient and kind. Don't laugh, and having them give the opportunity to teach back what you taught them. So we're going to start off with the Hispanic and Latino culture. I've spent a lot of time in a lot of different countries in Latin America, mostly, and each of those countries is very distinct and different. The food is different, the language is a little bit different. There's words and jargon that mean different things. Just like here in the United States, we have our regions that are different. The experiences and the language and the food that you're going to have in California are going to be different than what you're going to have in New York versus what you're going to have in Michigan or in Georgia. These areas are all different. They have different language and jargon. So I know that I'm lumping the Hispanic and Latino culture together. As with all of these other cultures, there's different cultures and tribes. So again, a little bit of a disclaimer there. This is one page representing millions of people. So just do your best and use your common sense inside this process. But there's a few things here that we want to review and some cultural considerations. Avoiding eye contact with a person of authority can indicate respect. So in our culture in the United States and white culture, making eye contact usually indicates trust. So make sure that you understand that just because somebody's not looking at you doesn't necessarily mean that they don't trust you or that you shouldn't trust them. There's often dramatic gestures or facial expressions. They have close physical proximity with family and friends. They're present-oriented, which means that the here and now is more important than yesterday or the future. And then they are very family-oriented with immediate and extended families. And so they may run late due to other important events or relationships that are going on. Their health risks that they most commonly face are hypertension, heart disease, diabetes, and obesity. And health perceptions can be that health is a reward or a punishment from God. So a reward being healthy and a punishment being sick. And then there's a lot of folk medicine, herbs, and things like that they might see. Then with nursing interventions, just allow some flexibility for appointment time. Develop a relationship with your patient and try not to rush them, and then review any alternative methods that they may be using, such as herbs and healers or prayer, anything like that. In the Native American culture, silence indicates respect. Eye contact can mean disrespect, and body language says a lot. So make sure you're watching your personal space. And then there's a lot of honor in the elders. There's sacred legends and stories, and there's a significant distrust of the white culture based on the history that's happened there. The health risks that can happen are alcohol abuse, obesity, heart disease, and diabetes. Health perception is that folk medicine is important. Illness can be caused by supernatural forces, and health comes from balance with everything around you. Also, for nursing interventions, you want to be aware of your own body language and what that might say. Be considerate of cultural needs. Encourage the patients to individualize their space, and they might need to hang some items that have significance and meaning for them. Allow for input from the family, and clarify communication and education. The Pacific Islander and the Polynesian community, there's some cultural considerations here, is that family is very important and can refer to many adopted individuals. Balance and harmony and like a holistic perspective are very important. Prayer, massage, and herbs and conflict resolution are all important in the healing process. So that's part of that holistic perspective. The health risks that often are encountered inside this community are cancer, heart disease, obesity, and diabetes. And then the health perception here is that health healing must involve mental and spiritual health and maybe making amends with other people. For nursing interventions, you need to assess the individual patient and their preferences, like we should do with everyone. Take time to get to know the patient and evaluate use of traditional medicine and healers. Those things may interact with some of the pharmaceuticals that we use. Then in Asian culture, silence is also valuable. Eye contact can also be disrespectful. Head nodding does not always mean agreement. It frequently means that they are listening. They have a very formal personal space, and tradition and ancestry play a very important role. The health risks that are commonly seen in this community are hypertension, heart disease, cancer, and lactose intolerance. Health perception is that it is a balance with spiritual and physical things. So we've got like the yin and yang, or the negative and positive energy. It may be seen as a gift from ancestors, and an illness may be due to sitting for too long or exerting oneself. So when it comes to nursing interventions, please be aware of their personal space, watch your eye contact, and be considerate of alternative medicine. In the Black and African community, head nodding may not always mean agreement. Prolonged eye contact may be seen as aggressive. Asking personal questions can be seen as prying or intrusive. Large family networks are very important, and religion plays an important role and brings strength. So some of the health risks you might see in this community are sickle cell anemia, hypertension, heart disease, and cancer. Health perceptions are heavily affected by religious beliefs, and some nursing interventions that you need to be aware of are to assess verbal and nonverbal communication, making sure that you're being flexible and that you're being aware of any alternative medicine that's being used, and encourage family involvement. In the Amish culture, they're very simple living. They are resistant to modern technology. They live separately from other communities, and they usually work as builders, farmers, and homemakers, and have a very patriarchal society. Some health risks that are common in the Amish community are genetic disorders and communicable diseases. In health perceptions, the church needs to approve hospitalization. This is due because the community usually comes together and helps pay for any hospitalization. And they may have a decreased health literacy. So as a nurse, it's important to make sure that you're going to simplify your education. And then something else to be aware of for nursing interventions is that a woman must have her husband or father present to make medical decisions. In the white and Caucasian culture, eye contact indicates being trustworthy. Silence can indicate respect or disrespect. Time is valued, and so people are usually very punctual, and they have various religious affiliations. So the health risks that we commonly see are cancer, heart disease, diabetes, and obesity. The health perception is the absence of disease is health, and stoicism is common when discussing health problems, so they will be very stoic and firm and quiet in approaching some of these health problems or issues. When it comes to nursing interventions, you need to make sure that you assess understanding, that you assess verbal and nonverbal communication, and encourage family involvement. So again, culture has a vast impact on health and the perception of health and the approaches to those diseases. So this was a very short video on a very big topic, and I understand that there's absolutely no way that we could cover it all, but the basis here is to make sure that you're assessing understanding, that you're assessing your patient, that you're being kind and considerate of their belief system and how that culture may affect their choices, and that you are educating in a simple and concise way and making sure that they understand that education. Where a person comes from has a huge impact on on how your treatment will be received. So be understanding of their individual culture and how it has intermingled with your own. So please comment below and share cultural things that you think might be insightful to other viewers of this video. We would all love to learn together.
Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.